He was the first pharmacist to head the ADA committee that annually updates standards of care in diabetes. But this year, Dr. Joshua Neumiller is serving the ADA as the president of healthcare and education and is here with us now with more on his presidential priorities. Pleasure to have you back with us this year.
Thanks for having me.
Certainly. Okay, so first off, how has your term been going? What have you been focused on?
It's been amazing. It's been an opportunity to really further understand all the amazing things that are being done at ADA, from advocacy to community-based interventions to work they're doing to educate people with diabetes as well as healthcare providers. And I've been fortunate to be involved in some initiatives this year really targeting people living with diabetes. We have a standards of care for people with diabetes. It's going to provide a guide for those individuals to go through, think about key questions they want to ask their providers, and really help facilitate some of that education. So I'm really excited about that.
You have previously said that pharmacists, as yourself, are ideal candidates to promote and provide education. Why so?
Yeah, I think pharmacists can play a really important role on the diabetes care team. A lot of people struggle with medication taking and medication behaviors, whether that be people with type 1 or type 2 diabetes. And I think pharmacists can play a very important role helping work with people to understand how to best manage their condition. And they can also serve as a hub. If people have multiple different providers engaged in their care, the pharmacist can help communicate between their primary care, their endocrinologist, maybe their cardiologist, and help coordinate care and make sure people are on guideline-directed therapy.
And you bring a personal angle to the table as well. How do you think your personal story helps you connect not only with patients, but with other physicians as well?
Yeah, I think it helps. I didn't want to necessarily work in diabetes until I went through that process of being diagnosed with type 1 diabetes and having to incorporate living with diabetes into my own life. And so certainly when working with people with diabetes, I think being able to relate to the struggles they have and say, I go through that every day too, is very helpful. And then certainly being able to convey that person with diabetes perspective when I'm interacting with physicians and other members of the team is helpful, I think, in many ways as well.
How much of diabetes care and prevention is education?
I think it's a huge component. If people are lucky, they see their diabetes care provider every 3 months. And all that time in between, they're self-managing their diabetes. We have to make sure they have the utmost education so that they can live well and manage their condition safely and effectively.
How do you feel like your personal journey has also helped you with your role as president?
I think it's helped tremendously, particularly this year when we're really focusing in on those educational pieces that target people living with diabetes. Being able to use my own personal experience to help leverage that message, I think, has been very helpful.
Well, best of luck with the rest of your term, and we thank you today for your time.
Thank you so much. Appreciate it.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.